Hi, I'm Dr. Prasan Prabhakar. I'm a practicing physician. I've taken my special training in cardiology and diabetology, which is there in my day-to-day practice. Now, let me ask you a question. When was it the last time that you consulted a doctor? A doctor, what I mean is a family physician. I think most of the time people are consulting specialists because the style of approach has completely changed. In my last 25 to 30 years of my experience, what I've noted is that today, when a patient develops, say, a chest pain, for example, the trend is to straight away see the cardiologist, not a general physician. If a patient develops an acute abdominal pain, the trend, what I'm seeing is they directly go to a gastroenterologist. Now, the problem here I see is I'll quote example of a case what I experienced a few years back. This patient was a middle-aged patient, about 35 to 40 years, a male. He developed acute severe chest pain. He straight away went to the cardiologist. The cardiologist took an ECG. ECG was normal, and straight away he underwent a lot of tests, and then finally he landed in the cath lab. An angiogram was performed, and the result was normal coronary arteries, and he was discharged. So there was no cardiological diagnosis for the chest pain. 2 days later, this patient comes to me and with the same history of chest pain, saying that all this was done. And I noticed that he has developed some skin rashes on the left side of the chest, which are typical of herpetic lesions, what we call as a herpes zoster infection. Now, herpes zoster infection has got a predilection for nerves, so it had involved the nerves and caused the chest pain. Now, had this patient visited a physician, all these tests could have been avoided. Now, I'm not telling that what the cardiologist did was wrong, but what has happened is, if a physician sees it, he arrives at a particular diagnosis, he does this preliminary assessment, because a physician looks at the body as a whole. And then he diverts. If a cardiological intervention is necessary, he refers to the cardiologist. So same way, a simple acute abdominal pain also can be treated by a physician. Now, the thing what I've noted is, once you build a one-to-one relation with your family physician, he knows your entire history in and out. What disease you had in the past, what risk factors you have, what disease you're prone to get. All this entire data is there with the family physician. So when you approach him, he's the best guide for you to suggest and to refer whether a subspecialty intervention is needed or not. Find your family physician and build that relationship, a doctor-patient relationship, a one-on-one relationship between you and your family physician. Because this, in my view, would be the most practical approach towards an efficient and a comprehensive healthcare. Thank you.